All right, we are back from the 2025 Borealis Psychedelic Science Summit in Stockholm. My name is Yoshi, and I am joined now by Dr. Robert Schoevers. Damn, I said it better before, right?
No, you're doing a great job.
I was trying to do the Dutch version, but Dutch is tricky with... I hear it's very easy to learn Dutch from Swedish and vice versa.
Yeah.
But the sounds, those are tricky. How do you say your last name?
Schoevers.
Schoevers.
Yeah.
All right. I'll work on it.
Yeah.
Until next time.
Okay. Fine.
How's the conference been so far?
Yeah, it's very interesting. Many people I would know either in person or from the literature.
Right.
So I think the organizers managed to put together a nice overview of many important aspects in psychedelic research today.
Mm-hmm.
And I also like the fact that I learn a lot about projects in Scandinavia, in Sweden, in Norway. And that's also very interesting. And there's always similarities, things you can learn from, creative ideas that you would think, why didn't I think of this before? So it's a lot of fun.
Fantastic.
Inspiring.
Glad to hear that. Tell me a little bit about your background and how you got to working in the psychedelic field.
Okay. I'm a psychiatrist. I was trained in Amsterdam in what you could say big psychiatry, so severe mental illness, crisis service, etc. I did my PhD in epidemiology. I was interested in risk factors for mental disorders and how one thing leads to another. And also, I've always been interested in where can we intervene to change the course of illness and what are the options. And now that I've become an academic, so I'm head of the psychiatry department, I got my PhD, I have a number of research projects, and more I am interested in what's basically the core of why we are here as academic psychiatrists, to help develop better treatments for the most severely affected patients, and specifically those patients for whom we don't have effective treatments currently. So that's how I started doing pilot work with esketamine about 10 years ago. And in the Netherlands, esketamine is the garden variety that the anesthesiologists use every day. So it's off patent, it's cheap. And we started working with that as off-label compassionate use treatment. And we made a sugar drink basically in which we diluted this esketamine. And so we saw really promising results, and from there, with public funding, we developed RCTs, and the results are quite hopeful. I mean, they're not perfect. We cannot help everybody, but we are able to relieve depression in patients for whom I would have thought this was not possible. So, for example, we finished a project where we treated patients who on average have an episode length of 5 years. They have had in their depression history 8 or 9 different antidepressants failed, and 60% of them have also had ECT without a real good effect. So this is about as treatment resistant as you could get. And in that group, we have like 45% minimally clinically important difference. So patients would tell us that they feel they aren't cured, but they feel that this really makes a significant difference in their lives, in how they experience themselves and what they're able to do, in how severe the depression is, which I think after everything they've been through is very nice.
Yeah, of course.
And what we so in my research group, we started with a focus on, does it help patients? And then we got more interested in why would ketamine work and what exactly does it? And what is the relationship with psychotherapeutic aspects? Because I have always been trained with the idea, and I'm a firm believer of that apart from psychopharmacology, apart from using medication for specific illnesses, the relationship and meaning making and the struggles that people have in their lives with things in the current or things in the past are just as important. So I think combined treatment is always something you should do.
Yeah. And
especially with depression, for example. So one of my PhD students, who's called Joost Breeksema, and he's also the head of Open Foundation. So he's an advocate also for psychedelics. But he interviewed patients in our ketamine studies, and he found out that in qualitative interviews, he was not involved in the study in any way, and he found out that the patients that we had been treating in the classic pharmacology way, in the sense that we are going to give you a new medication, we will put you in a quiet room, the nurse will come and check whether everything's okay and take your blood pressure. And if you feel dizzy or a bit funny, then it's nothing to worry about.
Yeah.
And we were meaning to do well. Everybody is very motivated to help these patients. However, when somebody, a relative outsider, was having a conversation with them, specifically inquiring about what did you experience under the influence of ketamine, and were you able to cope with that? And what would you have liked other than what we gave you? All of that. And it's a bit shameful, but it's an important example. Patients told us that they were, some of them, quite a number of them, were totally unsecure about how to navigate this overwhelming experience. Ketamine is dissociative, and if it's dose dependent, but people have a sense of losing control, derealization, not being in contact with yourself, with the outside world.
Right.
So you need to prepare them for that, and we hadn't properly prepared them. And so basically, from our experiences with ketamine, where we have now developed a much more elaborate support system. Right. So we have preparatory sessions. We have like grounding tricks, experiences. Techniques is the word I'm looking for. And we have a therapist who does the session with them, and we discuss, and that is the other thing that people told us, that during this session they might come across things that were very relevant for them, also in their depression, and that again they needed to process, because it could be quite confronting and provoking all kinds of emotions. And we weren't prepared to handle that after the session. So basically what we developed was preparation and integration.
Right.
And this was, for me and for our group, really a learning experience. And it also makes me wonder about the esketamine treatments, as they are often provided in many situations in the world, which also have very little support. I think we can do much better. And what we see now is, and of course we are now very much tuned to that, but we now see better results. We see that also also very severely ill patients are able to manage the experience and also make use of the experience. Right. And so this came as a sort of a bit shameful realization.
Right.
And the other thing is that it's not so surprising if you realize that one of the major risk factors for developing a mental disorder is having early life traumatic experiences.
Right.
So losing control in whatever setting is a red flag.
Yeah.
So that's basically not what you're going to do, and especially not with people you don't know and sit in a room that that you've never been in, etc., etc. So we were not sufficiently sensitive to all those aspects, and when we started understanding that and doing that, I think we improved our treatment a lot. So and at that point, we weren't like specifically interested into psychedelic treatments or psychedelic effects, but we were interested in whether such a treatment would also help catalyze a psychological process.
Right.
And that is the other thing we learned, and that we also studied in a more systematic way. What are the themes that come up during treatment with ketamine, and how do they relate to a person's symptoms, to a person's psychopathology, to their life history, and where are the handles for psychotherapy in that? And it's full of them.
Right.
And during that process, we got into contact with people who were involved with classic psychedelics. So we participated, we were invited to participate in the Compass Phase 2B study. And then we started developing our own projects. We have a number of ongoing projects. And recently, like 1.5 years ago, with an international group, we applied for a large EU project, EU Horizon, and we were very happy to get it. And we just started including for the SciPal project, which is psilocybin treatment in palliative care patients with end-of-life distress / depression. And in that project, we are including patients with uncurable medical illness, either COPD, ALS, MS, or atypical Parkinson's disease. And we are including patients who have significant psychological distress associated with the medical condition. And basically, this is what you might call a dream indication for psychedelics, because our regular treatments do not work very well in that phase. People have not much energy. Sometimes their life expectancy is also not very long. Antidepressants don't really do the trick in that patient group, in that phase, and also you don't want to wait several antidepressant trials before you get any kind of results. Psychotherapy, of course, talk therapy is always helpful, but it's also not super effective. And you would be greatly helped with something that has a large and also a lasting effect in order to ameliorate the phase of life where people are, to enable people to process grief, to grieve together with their loved ones, to think about what comes after, to connect. And there is hope in the literature. So the earlier studies have been done. Most of them were uncontrolled. And as has been discussed also at this conference, unblinded studies specifically with psychedelics is, there's always the chance that the aspecifical parts of the whole treatment play a very major role. So what we're now doing is a double-blind randomized controlled trial where we randomize high-dose versus low-dose psilocybin. We have 2 psilocybin sessions. So I think, and we all hope, it's a large group of collaborators, we hope that this study will help to determine the efficacy and safety in a very systematic, rigorous clinical trial structure. And then the other thing is that we have a phase 2 of this SciPol project, because the holy grail is not only to have immediate efficacy, but also to have that the improvement lasts. So we want to check whether the good results, which we hope patients will get, can be maintained over time. That is one of the other big knowledge gaps, because it's a relatively intensive treatment. You have 2 therapists with the patients in the room. You have the sessions before and after. So that's more than a regular psychotherapy or whatever. So that sort of needs to balance with the outcome. So that's and in the follow-up phase, we also have I think a highly implementable support module, which is predominantly online, with facilitators who are trained for that, but who are not clinicians, and some of them come from patient expert groups, and so we also try to design it in such a way that if the study comes out positive, that we will then also have something in terms of a support module that can be scaled and maintained over time.
Right. Interesting.
That's a long story.
A long story, but a lot of interesting stuff going on. I'm a little bit mindful of the time, since I think our next guest is coming soon. But tell me, what are you excited about in the psychedelic field in general, today or moving forward? I'm
very excited about the potential of psychedelics. I think it is for the first time in many years that something is appearing, and of course it has been there for some time, and then all the activity went down for many reasons, and now it's coming up again. But I think it's really hopeful that this is now happening. I also like it because it addresses a lot of aspects of psychiatry, psychopathology that I'm very interested in. So is it possible to sort of dilute all the internal boundaries that people have to confront things that are difficult for them? It's basically, it's psychoanalytically the model, right? So it has a lot of intriguing elements, and also the joint activity, the synergy between talk therapy and pharmacotherapy, and where does the one end and the other take over, or so I think there's plenty of room for exploration, and hopefully also for really meaningful new treatments.
Absolutely. Thank you very much for sitting down and having a chat with me.
You're very welcome.
Much appreciated.
Thank you. Thanks for the interest.
And thanks for everyone who's tuning in. My name is Yoshi from the Borealis Psychedelic Science Summit in Stockholm. Catch you next time.